Thanks, Tom, for having me. I'm happy to be here and support this brilliant technology. So my story is back pain. When I was a child, I was about 14 years old, and I had an accident. And I didn't know it at the time, but I had a significant back injury. And that back problems were a story in my life for most of my life. I had 5 children, and it just continued to get, my back pain continued to get worse to the point about 10 years ago. It had become to the point where it impacted my quality of life. And then about 5 years ago, it was so bad that it was very hard. It was very hard for me to function. I couldn't stand for very long. I couldn't walk for very long. I couldn't sit for very long.
Yeah.
Bad. Okay, bad. I was at the point in my life where I was pretty much in chronic pain, and it impacted my life, and it affected my quality of life and my joy of life. So anyway, I then had an MRI done, and the results of that, they sent me to pain management clinic, and they said there is nothing that they can do for me. Opioids was basically the solution, or surgery, and they didn't really recommend the surgery. I tried everything from massage to chiropractors to, does anybody know about prolotherapy? I did prolotherapy, everything. And then I ran into Tom, and I told him my story.
Yeah, how did the light end up helping you?
So I bought Tom's big light. So Tom, most of this conversation,
that's the big canopy.
Most of this conversation is regarding the little palm held light. I've got the light in Tom's background picture there. I've got 6 of them. And so it covers most of my body in one shot, one side of my body in one shot. And they changed, so I probably use it about 8 to 10 times. And each time I used it, I started to notice a longer time period before I was in a lot of pain, far longer than ever going to the chiropractor or going to for a massage, right? Like my results were longer with using the light. After 3 months, there was significant difference that I could actually talk about it. And a year in, so I'm 2 years in. I bought this light 2 years ago. About a year after using it, I am a new woman. I can dance. I can stand in the kitchen. So I have 5 children. They're all married. When we get together, we are 27 people. I have 12 grandchildren. So cooking is like, it's my life, but I couldn't stand long enough to cook. So I was dividing out what I could do at which time in order to get through and get something done. It was horrible. I can do anything I want. I can stand in the kitchen all day long. It's a new life. So, and I have to say, there are some side effects because I have this big light. I had tinnitus in my ears, like tinnitus. And
Yep.
on one side than on the other side. On the one side, it's completely gone. And on the other side, it's dramatically reduced. I had arthritis in my pinky. It's completely gone. It's just because I was using the light for my back, right? And the rest of my body is exposed too. Tennis elbow. I got tennis elbow. Now that was a tougher one to cure. But at least it took a year, but my tennis elbow is completely gone. Yeah, I could say more. So yeah, change now.
So that is fantastic. And you're able to do all these things now that you weren't able to do for quite a while.
Oh yeah.
And all of that because of it was a tobogganing accident, wasn't it?
It was a tobogganing accident, yes. Yeah.
When you're a teenager, I think.
I was 14 years old, and yeah, I landed on it. Yeah, terrible. Yeah. Even when I was making a few notes for myself to talk about this today, I said to my husband afterwards, just thinking about it brought back all the memories and all like how hard my life was a couple years ago, and how different it is now. Now I have to say, I still can't do everything. Like I still have a back injury, right? I have degenerate discs and herniated discs and spinal stenosis. Like it's not good. So I'm still limited with what I can do. But the daily, all the pain in my butt, the pain, the sciatica that I had a sacroiliac joint issues. It was piriformis issues. Like it was horrible. And I'm a new woman.
Okay. Well, with our next guest, we talked about the benefits that the light can have on the brain. And in this case, she had ongoing migraines, very bad for forget now 4 years, 5 years, and you'll hear firsthand what happened in her case. But I've had others as well that had long-standing migraines for many years. Like one particular person was over 10 years, and they used the light and their migraines were gone. They also had problems with vertigo, and that left them. And so I can attest to quite a number of people that have had migraines almost either totally eliminated or once in a while. And sometimes that may be they're not using the light for their particular situation. But anyways, here we go with our next. Her name is Hannah, a mother, young mother, and let's go for it.
So 4 or 5 years ago, I started having, after my first miscarriage, I started having chronic migraines. They were daily. And after about 2 years of treatment under a neurologist, we had them down to around 17 to 20 a month on average. And that was kind of as good as it gets. The neurologist told me that those were, pretty good numbers for someone who had been having them every single day. And that was kind of the best that we could hope for, was getting them down to kind of a manageable number. So yeah, 17 to 20, totally debilitated in bed migraine days most months. So.
And you have a family as well to try and look after.
I do. I don't normally dress in strange robes, but I have a 10-day-old baby that I'm nursing right now. And then we have 3 other children at home.
This is a first for our program. So you have a family, and it's pretty hard to cope when you're dealing with that kind of situation, isn't it?
Oh, absolutely. And 2 of our children have special needs. So their ability to understand why mom needed to be in bed and couldn't take care of them, and it was just really limited, and would cause a lot of upset. And my husband's in the military, so he doesn't have as much freedom to, he has plenty of leave and, can take sick days and stuff, but his job obviously is kind of a mission critical job. And so he's busy. And when I was down for the count, it was hugely impactful in a negative way for our family.
Wow. And then what happened? How'd you find out about this light, or what?
Sure. So my parents actually run a youth ranch a couple miles away from my house. And they have, for a couple years, had a youth group come out and do volunteer work from New York. And one of the gentlemen on their team started having some pretty significant health issues that he was able to recover from with the help of this device. And so when my dad was talking about my migraines and how impactful they'd been in our life, he recommended that we get in touch with you and see about doing a trial period with it to see if it would have any effect. So on October 21st, I started a 30-day trial with a borrowed machine, and within 2 or 3 days saw results. I mean, no, I mean, the first day I saw results, I just noticed a decrease in that general pain that's kind of always there. Like you don't, not every day is a migraine day, but every day you're aware could be a migraine day. And I noticed that feeling decrease right away after the first use. And I used it diligently. I missed one day during my 30-day trial, and I had a headache the next day, but it went away after a couple hours and treatment with the light rather than medication and an emergency room visit and injections and all kinds of things. And then we, between my parents and I, we've purchased 2 devices now, one for their house and one for here, and I use it every day. And I've had no migraines in about a month and a half.
Wow.
But in the whole period since October 21st, I have not had more than 10 total since I started.
Wow. So how do you go about treating? What do you do?
Yeah. So every day I spend about 20 minutes where I start on my left temple and I just kind of hover there for a couple minutes. And then I spend a couple minutes kind of going back and forth across my forehead. And I spend a couple minutes at my right temple. And then I use whatever time is left over, just kind of wanding the rest of my head, almost like a hairdryer. And that's consistent every day. One of the other things for me that's a migraine trigger is neck pain. And so on days when I'm noticing that there is some tension or inflammation in my neck, I'll also do a second 20-minute period, or sometimes a little shorter, 10 to 15 minutes maybe, at the back of my neck, and just wanding around that region to help reduce any issues that are back there.
Wow. So yeah, life has been a lot better these days.
Unbelievably so. I mean, just like night and day. It's that I think kind of the greatest gift isn't necessarily even not having migraines, but it's not having anxiety around migraines, because, you know, you can deal with pain. It's horrible, you know, but you don't really have a choice but to get through it. But it's awful on days when you're feeling good, or days when you have plans or something coming up and you're just constantly anxious, you know, waiting for that, you know, chronic illness to jump in and steal your moments away. And not having to worry about that. Like, you know, I have a 10-day-old baby. Like, I went into labor not worried about whether or not I would have migraines. We brought the light with to the hospital just to make sure that we could continue treatment while we were there. And you know, it's incredible to not have to worry about it. It's really getting your life back. It's amazing.
What did you find using at the hospital? Did you have anybody questioning you why you were doing this?
You know, I've talked to all of my doctors about it. I've talked to my physical therapist, my neurologist, my OB. They're all aware of what I'm doing, and they're all really interested in it. One of my doctors, my physical therapist actually was who it was. She said that when she was in school, they utilized red light therapy, and she's not sure how it's advanced or what the differences are. And she doesn't know why they stopped using it in the medical field that she's in, because she remembered it being somewhat effective at the time. But she said, to her knowledge, she just thought maybe it was something insurance didn't cover or whatever. But she was kind of aware of it. Everybody has been really curious. And I think my neurologist, more than anybody, he was a little funny, because, you know, he's worked so hard to try to help, and it just hasn't helped very much. And so when I told him, I'm like, I'm just not having migraines, you know, and this is what I'm using, he, you know, you could see him kind of hem and haw about it a little bit, but there's no denying the results. You know, I told him, I'm like, I'd like to get off of medication. And that's a part I missed in my history. I stopped taking the migraine medication that I was on. I was on a very high dose of propranolol, or I could be pronouncing that wrong. And I stopped taking that on March 8th and have continued on this same no migraine track. So.
And that's so no medication since March 8th.
Yep.
And totally free of migraines.
Totally free of migraines.
Okay. So you can see what an impact that the PBM using the palm light has had in her life to light up her world and get rid of this migraine. So migraine problem. So next we're going to have Josh Bowers on, and Josh, there we go. There we go. All right. There we go. Very
Hey,
good.
Tom,
Hi, how you doing?
I'm great. How about you?
Good, good. So Josh and I go back a little ways now. It's about 2.5 years, something like that.
Yes,
Yeah.
correct.
And Josh, I met Josh, or we connected through Dr. Praveen Irani at University of Buffalo. Josh, how about you tell us how you know Dr. Praveen Irani? And he's the one that eventually put the two of us together. But how did you get to know Dr. Praveen Irani? He's the one that is doing all sorts of research. He was head of World Association of Laser Therapy, and really a deep researcher on photobiomodulation. So how'd you end up meeting him?
It's actually a pretty funny story. So my kids said that they wanted to play badminton. And I was sort of thinking, like, the backyard? Like, what are you talking about? And they're like, no, we want to join a badminton club. So not a badminton player, didn't know much about that, but I joined the club. And Dr. Arnie and one of his kids were part of the club. And so we got to know them over the years, over several years, in fact. I knew he was a researcher at the University of Buffalo, but did not know in what area. But then I started having health issues, and he basically said, "Hey, I think I have something that can help you." And then from there, he told me and showed me all about photobiomodulation.
Okay, and what kind of problems were you having there, Josh?
So I started having seizures, and they ranged from initially a grand mal seizure just out of the blue, but then I had some little ones and a few more bigger ones.
Okay, that kind of interrupts your life, doesn't it?
Oh man, I couldn't drive for a while. I had to work from home. Yeah, basically, completely turned my world upside down. But from there, Dr. Arnie brought me into his lab, showed me a variety of light units, told me how they worked. From there, put me in touch with you. And
But
I ended up,
before that happened, he treated you with
so we
the
did.
light,
Yes.
and
Yes.
with the lights he had, not my light in particular, but treated you with a laser with
Correct.
8-10 nanometer, and you had some pretty good results with that.
Exactly. Yeah, had some great results. I sure did. So I knew it worked. Okay, I knew it worked. So then when I had a setback, I ended up calling him. I'm like, please, can I come back? And he said, you're at the point where, it's an inconvenience for you to drive over here. It's an inconvenience for us to schedule time. I'm just gonna put you in touch with Tom. He's got the very best unit for home use. And from there, that's what sort of our relationship.
Right, right, and that was in the midst of COVID,
It was.
over 2 years ago. So they had problems in the university trying to make that all happen, to open the door to get more treatments for you. So that was an impossibility. So then it was great that I had known Dr. Rennie about 2 years earlier than that, prior to COVID, and he knew all our light technology. So we were working back, and I ended up hiring him as part consultant to do some work. And that's when he ended up mentioning about utilizing the palm light for yourself. And so you started using the palm light daily on the area, right?
I sure did. Yes, and with tremendous success as well. I'm not sure if we mentioned this already, but since using your light unit, 2.5 years now, seizure free, no issues whatsoever.
No issues whatsoever. Nothing.
No issues. And it's amazing. Not even a headache. Okay, so I was having migraines, dizzy spells, small headaches here and there. It's completely been eliminated. It's truly a miracle.
Wow. And what was the treatment? What did you use for treatment protocol? I know we recommended, but what did you end up doing?
So I have my light, and so there's a little bit of trial and error, okay, when it comes to the brain, and I think Dr. Arnie will mention that you want to start slow and sort of work your way up. So with me, initially it was the whole head, okay, so he would go 2 eyes is the best way if I can just go around my head here, two above 2 eyes, 2 temples above 2 ears, back of the head, top of the head. Okay, so actually, holding it there against the skin, okay,
Right.
for a couple minutes. And so, for me, he started me out slow, say, minute to 2 minutes in each spot, and then eventually the total treatment time was up to about approximately 20 minutes. So, as I've sort of developed my habits, and again, I use this nightly. This is like part of my bedtime routine, right? Like it's more important than brushing my teeth, right? Like it's a must, right? It's something I got to do before I go to bed. So I have found, through researching my MRIs, trial and error, and so on, that because my scar tissue is on this side, there's inflammation associated with that, and this could be the focal point that is causing seizure activity. So I sort of focus on this side of my brain over here, and again, this is just unique to me and in my condition. Okay, but basically, I'm on top of the head for about 5 minutes. Okay, temple, above the ear, back of the head, and total, focusing on this side is about 15 to 20 minutes when all said and done.
Yeah. And the funny thing is you've also had another little side effect. You mentioned something about a little bit of hair.
So this is pretty funny. I noticed that hair on this side, because this is where the light is shining. This side of my head grows faster than the other side. So occasionally I'll send you a selfie, and I'll be like, look at this right here, right? Like this side is longer than this side. I guess it is a side benefit, yes.
Yeah, it does help promote hair growth, especially for those that have a little bit less. Yeah, that's kind of interesting. So tell me more about some of the other applications, first of all, in-home applications. What have you seen this light being helpful for?
So truly, this is our go-to, okay, in terms of our first aid kit. And initially, okay, it's sort of an educational level with the rest of the family, right? Like they know that daddy's using this for his head and it's helping him. But when it comes to other bumps, bruises, fractures, and so on, it's like, okay, let's try the light. And they're like, really? This will help? I'm like, let's give it a go, right? So my daughter had a hairline fracture in her foot from volleyball. And again, it wasn't a huge crack or anything, but the doctor's like, look, you're going to have to be in a boot for 6 weeks. So she started wearing the boot, but every night started treating her with the light right on the spot where the break was, right where the x-ray showed the break. And so I was hitting her hard, okay, 20 minutes a night. And we went in for a 3-week checkup, and the doctor asked, well, how you doing? How's everything going? She's like, I'm great. I'm walking around just fine. He's like, well, let me put you through a couple of different things here to see how it's going. And she was able to jump up and down. Okay, and so the doctor's like, well, I guess you're healed, right? Like our time here is done. You don't have to wear the boot anymore. So 3 weeks, right? 3 weeks healed and back on the volleyball court. So just super impressive there. My wife, similar story. Okay, so she had a rolled ankle, and almost the exact same story, right? Boot, but after like 2 weeks with her, she was able to take the boot off and walk normally again. Some couple unique things with my son, just really quick, just because I find this so interesting. First off, he split his big toenail. Okay, little guy, right? He's 10 years old, split his big toenail. And so, Tom, you sell these probes, right? The probe that basically comes off, can centralize in a very small area that light output. So I started using it right on his big toe, and it really, I mean, look, toenails take forever to heal, to come back to life, but immediately, right, like this thing started to grow back together, and just pretty amazing how that happened. And then he had a mole right here, okay, that the dermatologist removed, and the dermatologist just said, hey, look, he's little. This will go away over time, but you're just going to have to, realize that it's going to take a while. You're going to see it for a long time. So again, I took that probe, and got to recommend the goggles here as well, right? Like you sell the goggles too. So put the goggles on him. And I started taking that probe and putting it right here. And if you were to see him today, okay, you wouldn't even realize that he'd ever had a surgery. It's just, it's absolutely amazing.
Yep. And then you've been able to see other people. You're working with me now, and you've been able to see other people helped that have used the light. Any thoughts on some people that are close by or further out? Well,
Oh man, yeah, I tell you what, it's so many people have benefited, and it's been amazing to be part of this work with you. I mean, several come to mind, but a couple just to mention. A boy in our neighborhood actually had a concussion, a significant concussion about 2 years back, and he fell on the concrete floor and cracked his head, and like things were never the same with him, to the point where they had to put him in a special needs class at school because he couldn't see right. He couldn't take the bus because he was getting motion sickness. I mean, just a very difficult situation. Well, they bought a light and started using it on him, and he more or less made a full recovery. I mean, the parents were blown away because they had tried so many things. I mean, their poor kid, and seeing a little guy in this situation. Okay, but more or less made a full recovery because of the light unit. So once he saw tremendous success, he said, "Hey, Grandma, right? Grandma was having this neck pain." So he ends up giving the light to the grandma and says, "Grandma, here, try this out." And so she starts using it all over her neck, and like she wakes up one morning, she's like, "Oh my gosh, there's no pain. Like, what happened?" And so just amazing how this revolutionized the whole family. Just amazing. Amazing story there. And there are others, right? There's a couple people who had broken arms. Okay, that similar to my daughter, the healing process sped up, the inflammation goes away, and half the time is what I think that I'm seeing anyway from my side, that the doctor will say, hey, it's going to take so long to recover. Well, once we start using the light, we see the recovery happening about half the time. Pretty amazing. Maybe just one more. That's going to be our friend Crystal down in South Carolina. So she had a tumor, a brain tumor, and had a couple brain surgeries. I mean, very, very scary, very, young kids. I mean, similar to the story with Hannah. She was having migraines, she was having mini seizures, and she was uncertain as to her, to her future, right, her livelihood, and so on. So she bought a unit, and same thing. Worked wonders, has worked wonders in her life, to the point where she's even, she doesn't use it every day now. It's helped her so much. She's cured, right? In her mind, like she's had so much success that it's eliminated any problems that she's had. So just a remarkable testimony to what the light has done in her life.
Well, Josh, I thank you for sharing with us tonight, and for the group that's joined us. So they get a chance to hear how this can affect the brain many different ways and healing throughout the body. So Josh, I want to thank you very much for joining us. And now what we're going to do is go to our commercials.
Thanks, Tom.
All right, all the best. All right, so when I said commercials, I wanted to talk about our product. So we have different models. We have the SunPowerLED Palm Professional, and that has the 2 wavelengths. It has the 660 nanometer wavelength that you can see coming off of this thing, and it has the 810. Now, the 810 nanometer is not very visible, but you can see the lights that are the LEDs that were lit in there. I can feel the energy from this device, but nothing's hot, but you can feel it going in and it starts warming the skin a bit. By the way, you can put in your questions in the chat area, and we'll gladly try and answer them. So please start putting up your questions, and we'll try and answer as many as we can. So that's the Palm Professional, and then we have the Palm Ultimate, and this device is the same as the Professional as far as area. It's 40 square centimeters of area, and the whole area is putting out this high intensity energy. So if I hold this up like this and put the light behind it, you can see how it's very even over that area, the light output. So the same thing happens with the near infrared, but the near infrared, you can't see it. So we have the unit for the Professional for $975, and right now, as I mentioned, we have a 10% discount off of our devices, the Professional, Ultimate, and Super Palm. So this unit here, the Ultimate, is $1,300 minus the 10% for that. And as I mentioned, you see the 810 nanometer wavelength. I can see it not only through the camera on the screen here, but I can also see it with my eyes visually. This here happens to be what we call our Super Palm, and the Super Palm has as well that high amount of energy, so you can see it coming right through my hand here, and that's the red 660 nanometer. Now, if you were able to see this wavelength, I can't see it. It's totally invisible. Nobody can see it. No human can, anyways. But you can see these purplish dots. That's just because the camera here can actually pick that up, that wavelength. But otherwise, it's totally invisible. Now, 1050 nanometer has the potential to penetrate a little bit deeper. That's why we have this wavelength, because so this is called the Super Palm 1050. So there's the Professional, Ultimate, and the Super Palm with the 1050. Now it runs off of a power adapter, so there's no batteries to recharge, no batteries to wear out. This has got our devices have a 1-year warranty, or the Super Palm has a 2-year warranty, or if we get into the mini canopy or the helmet. So let me just show you here with this, as far as that's the Super Palm. And what I was going to say is, because it runs off the wall, you can run it continuously. The LEDs in here are the way we're cooling them. There's a life there of over 50,000 hours. That's like 25 years of 2,000 hours a year for the LEDs in this device. And the nice thing about this too is you can pack this all in your carry-on, because it doesn't have any lithium batteries, bigger lithium batteries. And as many travelers will know, you can't bring lithium batteries, larger lithium batteries, into a plane because it's a fire hazard. But there's nothing here with this, so it's easy to transfer, like throw it in your luggage and go anywhere with it. And sometimes you may need that wherever you go to get, if you sprain your ankle or you do something during your trip, it can help save your trip, because you can still maybe walk, or if you have some kind of injury, it can certainly help speed it up. I will suggest that you go to SunPowerLED.com, click on the shop button, and you can purchase the units there using that code, the promo code It's a BLK FRI 2023. So that promo code will allow you to get the 10% off. We also have the what I call the mini canopy. This here device has a area of 15 of the palm units. So you can do a very large area of your back or neck or legs, and it works very, very nicely. You can angle it at whatever angle you want, raise and lower it according to where you're trying to treat. It has the 2 wavelengths as well. So I have the 660 and I have the 810 nanometer. The 810, you can just basically see it there a little bit, because you can see the lights, but you can definitely feel the high amount of energy from this. So we have a stand that comes with it to be able to use it. So now I'll show you the other device that we have here is our helmet. This device is, it has the 2 same wavelengths. This is the 660 nanometer and the 10 nanometer. You can see that in the back there. And there's been all sorts of applications for that where people, this could be more used for a clinic model, or there's a lot of research going into using this for other types of issues with the brain, Alzheimer's, dementia, and just a host of different things, including concussions and strokes. All can be helped by using light therapy. There's a lot of research out there. If you do go to the SunPowerLED website, you will, there's also a place for resources. You can look up the research on it and learn all about why light can have such an impact on the brain, or on, well, right down to the toenail, as you heard tonight in the description. But there's a lot of work being done as well for oral mucositis. If people are involved in cancer treatment, chemotherapy or radiation, if they do light therapy during the chemotherapy, it's a good chance that they won't have really nasty sores inside their mouth. And some people, the chemo affects them so greatly that they have to go on a feeding tube and stop even the chemotherapy. So it's something here that the light therapy could actually allow the treatment to go through to the end without the need of a feeding tube, because their mouth is so inflamed and everything's happening. So it's now becoming a new oral mucositis to do with cancer, and using light therapy, the term photobiomodulation, or some call it red light therapy, but photobiomodulation is really the best term to cover all that. Very beneficial to avoiding the side effects of chemotherapy. And so that's another application for that. And as a matter of fact, in California now, I think it's the first state now that has suggested that a PBM be used as a standard of care for anyone going through chemotherapy. So this device, just remember too, Christmas is coming up, and for those that have everything, this is one device that'll last them for years, and it will be useful not just to the one person, but everybody they're connected with, because we all get injuries from time to time. So I will answer a question or two that's come up here now. So Janet's here. Okay. Okay, so Janet mentioned I have had considerable success in healing sores, canker sores in my mouth. And in her case, it has not been as helpful for the arthritis in her hands in her situation. Everybody is different, so that's one thing. It's not 100%. Okay. So Veronica is mentioning, have you heard any success with treating dry mouth, burning mouth syndrome? Yes, Veronica, we are working with a researcher in California. Dry mouth is also called xerostomia. A lot of people, as I mentioned, that go through chemotherapy or radiation can end up with dry mouth, burning mouth symptoms or syndrome. It's very bad. There is also the issue of taste. Some people, when they have this burning mouth syndrome, can also have a flip on taste. So something that is, you know, that you would normally think that tastes really good. If somebody has this issue, they may taste it and it tastes like rancid or even worse, tastes like something totally ugly, and it really is something that they can't almost can't handle. Burning mouth syndrome, some of these things are stuff that can even cause people to think about suicide. It's that bad. Dry mouth, as I mentioned, with xerostomia, it's been able to help the light, been able to help the saliva glands to actually start producing better saliva out of in the mouth. So dentists have been using that to help some of their patients with that. Okay, my wife has systemic lupus, as the illness is directly affected by sunlight. Any advice in using the handheld frequency and any other concerns? Currently, we are using our neighbor's light on knee pain for about 1 week, and now has been off 2 days awaiting on receiving the new unit. Okay. Well, yes. So as far as to do with lupus, we have not been able to help with getting rid of the lupus. That's one of those things that's systemic and can show up in many different forms. But the great part is that it actually helps the body's own immune system start working better in those areas, so they can have pain in different parts of their body, and so caused by lupus, and they're able to see a change. Now, as far as the light goes, triggering lupus from the sun, one thing that sunlight does have, does have wavelengths in the range of from the sun all the way from far infrared, near infrared, what you see with the rainbow, all the way through to blue, green, blue, and ultraviolet. And ultraviolet can trigger a lot of things on the surface of the skin. Ultraviolet, there's different forms of ultraviolet that comes from the sun, but that is usually the range that is what triggers challenges with people with lupus or skin sensitivities or whatever. It's really interesting that if you have a sunburn, and you probably know this, the last thing you want to go out is under the sun. And in this case, what happens is that because we're operating in the red, near infrared part of the spectrum, as opposed to the blue-green, on the other end of this blue-green UV. On the red side, you don't have that pain. So if you're in the sun, it's because you're getting some of that UV hitting your skin if you have a sunburn. And if you have any type of burn, as a matter of fact, going out in the sun usually is a killer, so you want to stay out of it. But as it turns out, that red light is very useful in helping to heal the skin of that burn. So I was in Haiti in 2010. I was not planning to go there, but when the earthquake happened, I talked to one of my friends about going down there. About somebody taking our technology to be used down there, because I had heard about the burns and fractures and all the things that had happened with this really bad earthquake that happened. And so I talked to my friend, and well, in this case, I happened to pray with him. And next thing you know, I says, well, he says, you should go. And I says, well, how am I ever supposed to go there? All they have is doctors going down there. Next thing you know, 3 days later, I'm in a flight packed with doctors, and I'm the only one that's not a doctor. And I ended up using our light technology outside the hospital. Now, everybody was outside the hospital because they were scared the hospital was going to collapse because of the earthquake. There was a lot of cracks in the foundation and everything. So everything was done outside in MASH tents. And I can tell you just two little stories. That one was a person with their second and third degree burns on their legs. A lot of women ended up with just happened to be at the time of day when this happened. They were in the kitchen and probably preparing a meal or whatever. And when the stove pulled away from the wall, it snapped the line that had carried the propane into the stove, and the propane came out of the hose. And propane is heavy, so it lays a layer down very low on the ground, and the pilot light would have ignited the flame, the gas, and flame front across the floor. So these women had second and third degree burns, and we were using our light technology on their fresh burns, and it reduced the pain very quickly, usually in 10-15 minutes on the surface of the skin. It was quite amazing. I remember another case when so I was working with an orthopedic surgeon, and he said, Tom, here, I'd like you to treat this young boy. And he said, he's got a broken foot. And he says he's in a lot of pain. Well, when I went to see him, the child was crying, and he says he couldn't do anything because they had ran out of all medications to even alleviate any of the pain. So he says, Tom, can you use the light on him? So I on his foot. So I did, and left it there because we had a number of units, and the parents were just holding it there over his leg. And we came back an hour later, and the orthopedic surgeon, they were speaking Creole, which is a French dialect of some kind. And the orthopedic surgeon turned back to look at me, and he was just shaking his head, and I'm thinking, oh no, something went wrong. And he says, I said, what's wrong? He says, no, nothing's wrong. He says, I'm a senior orthopedic surgeon, and I saw the x-ray of this young boy's foot, and he should be still in extreme pain, and he has no pain. And that was without any types of painkillers. So what the light does is help reduce the inflammation in the area, help speed up the healing. And he was absolutely shocked because he said, I've never seen this before. So for light, it can be used on the skin, even when you're talking burns or other types of injuries. And we have a neat video too. I'll try and get it up at some point, where a woman skinned her. I think it was off a motorcycle, and she skinned her elbow, skinned her knee, lost big patches of skin, and the fact that she was able to show in this video that already in 1 week there's no scabs in the area where she lost the skin, that there was already a layer of skin that had gone down. Probably it needed much more healing time, but it looked very impressive from that. So anyways, yes, it can help very much with healing of the skin. And so there's a question here from Terry, and also Sharon. Sharon, I'll come back to your question. This product is amazing. It looks like it can help the body heal pretty much any issue. I look forward to getting one. I'd like to know if the probe is eligible for the 10% off as well. Yes, I will make that available for you as well, for the probe. Okay, and Sharon, have you any testimonials from people who use the PBM for osteoporosis? I can't say exactly on that. Different forms of arthritis. Also, there's research that shows how this can help with bone growth. So somebody had lost a chunk of their jaw from the jaw from the erosion that took place from the bacteria, and they were able to see further pictures, further x-rays showing how healing is starting to take place and the jawbone will start to grow back together, which is fantastic. So I can't say I have, but there is on our website, SunPowerLED, if you go to the area on there, if you go to SunPowerLED, there's resources, and under resources, there's a tab there for you can find PBM findings, and under the PBM findings, you'll see a research port which will allow you to get into a spreadsheet where there's over 7,700 research papers on all different kinds of conditions. So for PB with photobiomodulation. So anyways, that's something that is an easy place to search out for, let's say in this case, osteoporosis, and learn what it is. Okay. Next, Veronica, I'm experiencing it. Very good. Very good. I believe from hormonal changes. How long would you use the light? You know what, Veronica, I'll get into a separate, email me and we'll try and talk a little bit about that further. Okay. Deborah mentions, will this help xerostomia from head and neck radiation? That is, so it depends. If your saliva glands have been totally destroyed by the radiation, then it's a good chance that it's not going to be helpful to you. But if there's anything left of your saliva glands, it's possible to improve, start healing that area and increasing the amount of saliva flow. And dry mouth xerostomia or dry mouth by the way, if anybody feels that their mouth is extremely dry because whether they've gone through some kind of past cancer treatment, you really should be addressing that, because you'll lose teeth. It's the bacteria isn't correct in the mouth, and there's also all sorts of problems with that. So there's also the mention of periodontal disease, and again, it comes back to the light helps the immune system to help the immune system to improve and be more effective. And so there's a very good shot that you can improve your oral health by light. And Deborah, if you wanted to contact me on that, there's one other possible solution, but we'll talk about that offline here. So tonight, I think we've addressed most of the questions. If you still have a question or two, please email us at info@SunPowerLED, and we'll try our best to answer that. Otherwise, I want to thank everybody for joining us tonight, and please share this with others. We also are not going to have a webinar next week Tuesday, but we'll regain 2 weeks from, we'll restart again in 2 weeks. And I have very special guests lined up, and I'll get into it. I'll send out some emails when everything's perfectly confirmed. But again, thank you for joining us. Wish everyone God's richest blessings.